the most important difference is that silent means that the patient is unaware that there is a heart attack going on in the body at that moment. As a routine part of routine evaluation, and then we see some on the test, we see some proof that patient has had a heart attack in the past, or he comes for some treatment of any other associated illness like diabetes, then we come to know that he's had a silent heart attack. So generally it's that's the general presentation. And another, if somebody is having an active heart attack, and very rarely this category of patients, this is a very rare small group, they don't have classical chest pain. So they have atypical symptoms, something like there'll be some sweating over the forehead, or patient may have a little bit of giddiness, and they will deny that they have any classical chest pain. So when we do the test, at that time we do an ECG and all, then we come to know that there is a heart attack, and then that would be also labeled as a silent heart attack. So that's how it goes about. The risk is a silent heart attack has got the same risk profile as a normal heart attack. In fact, I would say it's slightly more than a normal heart attack, because when you have symptoms, a person generally does go to a doctor. A lot of times they immediately rush to the emergency. But you have a silent heart attack, the chances are that heart attack may be missed, and that can be catastrophic for the patient. So that's the major difference between the two. The treatment and subsequent care thereafter is the same. So the risk profile of somebody coming not getting adequately treated is more in a silent heart attack. And this is especially important during the immediate phase or during the initial emergency, when the emergency is ongoing. So I think that's true. What happens is generally the occurrence of silent heart attack is there in what we call as high risk. The most important of the risk factors which silent heart attacks. The underlying story is that with diabetes, there is associated diabetic neuropathy. So what happens is the nerves because of diabetes. So that is why the sensation and the feeling and the reactions are decreased or diminished in diabetics. So diabetics will generally do have more incidence of silent heart attack. So that's and they form the chunk of patients who come with silent heart attack. That's a very important thing for diabetes. So what we should advise and what we should recommend to everybody is that firstly we should be aware about what are the risk factors for having a silent heart attack, and we should try and reduce those risk factors. So risk factors, the first one is anybody having diabetes should get a proper evaluation from a heart perspective also. It's a very common phenomenon that we see, that people with diabetes, they do not focus on their heart, and they miss out on getting adequately treated for heart disease, and they're at more risk for a heart attack. In fact, in cardiology or in our practice, anybody with diabetes we consider them equal to having a heart problem. So a diabetic is equal to a patient of a heart disease. So the bottom line is anybody with diabetes should mandatorily undergo a proper complete heart evaluation.